From KETK, you're watching East Texas Live.
Welcome back. It's Medical Monday, and joining me now is Dr. Clark Wilson, a board-certified urologist at UT Health East Texas. And today we're talking about prostate cancer. Thank you so much for joining us here today.
Thank you for having me.
Yes, sir. So first, can you just tell us a little bit about what prostate cancer is?
Sure. Prostate cancer is a cancer of the prostate gland, and it's the second most common cause of cancer death in men, and the most common cause of cancer in men outside of skin cancer.
Yes, sir. And so how can prostate cancer be detected?
So most cases are diagnosed with routine screening, which consists of a simple blood test called PSA, as well as a physical exam, including a prostate check. Some men are diagnosed after symptoms develop, and in those cases, it's unfortunately very advanced.
Yes, sir. And so how is a prostate screening kind of performed?
So a simple blood test as well as the exam are the main two things that we look at. And the blood test is called PSA. And the exam does include a prostate exam, which many men are hesitant to undergo, but is very quick and generally over very quickly.
Yes, sir. And so who should be screened for prostate cancer?
Sure. So for most men, that's going to be between ages 50 and 70, every 1 to 2 years with the exam and the PSA check.
Yes, sir.
For men with a family history and African-American men, it should be done even earlier, typically around 45, but in some cases 40 if the family history is extensive.
Yes, sir. And so what are the next steps if somebody was screened and they got prostate cancer?
So previously we used to go to immediate biopsy. Now we have many additional tests available to help be more selective in who gets a biopsy. So the most common test we order after an elevated PSA is a prostate MRI. And this is just an imaging study that does help determine if cancer is present. It's not a substitute for a biopsy, but it can help reduce unnecessary biopsies in many cases. There are also additional new blood and urine tests that we can use to help be more selective in who gets a biopsy.
Yes, sir. So is there any new developments in the prostate cancer treatment? So
for prostate cancer treatment, radical prostatectomy with the Da Vinci robot's been around 20 years now and is the standard of care. Some newer developments in that include fascial-sparing prostatectomy and what's called Retzius-sparing prostatectomy that minimize the risk of significant urinary leakage. And we're able to offer that to select patients at UT Health East Texas at this time.
Yes.
For the medical therapies for men with advanced cancer, there have been an enormous amount of new developments there, and men with incurable prostate cancer that's very advanced can now live for many years despite having incurable disease with these new treatments.
Yes, sir. And so why is it so important to spread awareness for prostate cancer screenings?
Sure. So it's very important for people to be aware about prostate cancer screening because when patients aren't screened, due to the high incidence of prostate cancer, we see many men diagnosed at later stages where it's often incurable. And we're seeing, unfortunately, an increase in the amount of men diagnosed with late-stage prostate cancer now as a result of decreased screening over the prior 10 years.
Yes, sir. What would you tell people that are kind of hesitant or nervous to get a screening?
So I would say that it's quicker and easier than you think, not to be afraid of a simple blood test and a quick exam.
Yes, sir. And where can people get more information?
Sure, absolutely. So there are many good resources out there. UT Health East Texas has a website, and of course your primary care physician, and then other validated resources online.
Yes, sir. Well, thank you so much for coming in and telling us all about it.
Absolutely. Thank you for having me.
Yes, sir. For more information, go to the website right there on your screen.